So my name is Shelly Massingale. I am the Senior Director for Sports Medicine across our system at Banner Health. And I'm a physical therapist. So I have been a PT for 26 years now, and my entire career I have specialized in neurological rehabilitation as well as vestibular imbalance therapy. So this building, the Banner wanted to build something like this for the past probably 5 years, but I'm going to go back 10 years. So 10 years ago, I was treating neuro patients, brain injuries, spinal cord injuries, and also treating vestibular imbalance patients. And we have a physician that was working at Arizona State University. He was the team physician. And he was, at that time, having athletes, primarily football players, but they would, get concussed playing football. And he was testing their balance, doing what we did 10 years ago, which was not a lot when it came to concussions. And he knew me, and he knew that I was treating balance problems. So he sent a couple of his athletes to me, and I started treating them. And what we found was that, number one, they were getting better a lot faster if they did vestibular imbalance therapy. But even more importantly, some of them would come back, many of them, and tell Dr. Erickson, like, oh my gosh, I feel like I'm actually better at my sport than I was before the concussion. And that really, I think, is very much plays into what this type of therapy can do for patients, for all of us, but as well as for athletes. So anyways, long story short, Banner has been so wonderful. They backed Dr. Erickson and I up. We wanted to open a multidisciplinary concussion center. So we did, and we opened one up in downtown Phoenix. So this building is in Scottsdale, but downtown it's a multidisciplinary concussion center. We have all disciplines that treat this diagnosis under one roof. So it's led by physicians, primary care sports medicine physicians. We have vestibular imbalance therapy. We have neurooptometry, functional visual retraining. We have neuropsychology, athletic training. So every clinician that would touch this diagnosis works together under one roof as a team. So we were quite successful. And with that and the vision of Banner wanting to open up a sports medicine center, we came to this building right here. So we actually went backwards than what most places do. Most places open a sports medicine center and put a concussion center in there, and we went concussion center, open up a sports medicine center. So this building that we're in, and I'll look around, is amazing. So we're in Scottsdale, Arizona, and it's an 80,000 square foot facility. So in this facility, it's really what we call a destination sports medicine center. So everything an athlete would need when it comes to injuries, medical care, imaging, surgery, physical therapy, all the way to injury prevention. We have a Banner Imaging Center within this building. We have Banner Physical Therapy in the building. We have a high performance center, which is really a true performance enhancement center. It's all motion capture, and it really is working with athletes that are healthy and improving their game, and also working on injury prevention. On the second floor is a clinic. So we have a full clinic. This is where we are on the second floor. There's 48 exam rooms, and then the same concussion center that's in downtown Phoenix is replicated here. So we are in the vestibular imbalance gym right now on the second floor. And then on the top floor is an ambulatory surgery center. So there's 6 OR bays, and so really an athlete can do their entire journey here. They tear their ACL, they see one of our physicians, the physician gets an MRI, then he does surgery upstairs, then they go to Banner PT, then once they're better, end up in the high performance center. So that's really, in a nutshell, where we are today. A patient can come here and be referred by pretty much anyone. I'm going to talk specifically to the concussion center. The majority of the patients come from maybe an athletic trainer is on the sidelines and they refer their patient in to us. We will have physicians refer to us. We will have neurologists sometimes send their patients to us. Patients can also refer themselves, so they can come here and just know they had a concussion and just come in and see our physicians. So we get referrals from audiologists, and I think that that's one of the best ways to get some of these concussed patients in here, because the audiologist will already have done a lot of the exam and the clinical assessment for us before we see that patient. So, so really anyone can refer to here. So when an audiologist refers to us, to me personally, it's ideal, because all of the assessments that I want to do, the audiologist usually does also. So the nice thing about what we do here, though, is any patient that comes in here will always start with the physician. So an audiologist doesn't refer directly to Shelly. So the audiologist would refer to the concussion center. One of our physicians, sports medicine trained physicians, will see that patient and then do the assessment. So I'll have, by the time I see the patient, I could have the full evaluation from a physician and a full evaluation from an audiologist. But what's interesting about that is that even if I have all of that information, I still will always do my own complete evaluation, because really the nature of concussion is that it is very rapidly changing, and these patients get better so fast. Some of them don't, but the majority of them get better fast. So almost every day you need to reevaluate these patients that come in here. But what I love about the audiology assessments is that those are very pertinent to me. So, so at least I have that battery to kind of get me started, but I commonly do the same assessments again myself. So we do, here at the Concussion Center, we use subjective symptom scales every visit that the patient comes in. Now we truly believe that when you treat a concussion or you're diagnosing a concussion, that we need objective information, but we do rely on a subjective scale. So we use the post-concussion symptom scale, or the PCS, varying names, but it's a scale of 22 symptoms, and it's rated 0 to 6. So 0 is I don't feel anything, and 6 is the worst it could be. And then it's added up, and you can get an overall picture. So the symptoms they range from everything you see with a concussion. It could be memory problems, dizziness and balance problems, nausea, you can't sleep, all visual problems. So it's all aspects of concussion. So you really get to see kind of the picture of where your patient is at that time. And we rely on that because we then look at it every time they come in. So you can really see, and it can change from someone will have a 10, on the symptom scale one day, and a 50 the next day. And it has a lot to do with sleep, what they did, how much activity did they do, a lot of the emotional state. So it just helps us all as a team see where our patients are. So for me, my most important assessments when it comes to concussion, my favorite, and it's just me personally, is to do a very objective balance test and gaze stabilization testing. So along with symptoms and a full exam, an oculomotor exam, but gaze stabilization testing for concussion I find is extremely important, because one of the main complaints when I have somebody come in, and they're only coming to me because they're dizzy, right, is that they feel like they can't move their head, and I mean, I would say they can't move their head and clearly see, but they don't explain it like that. They say, I feel like my brain's sloshing around in my head. When I play a sport, I can't really see the ball like I used to. When I run, it makes me really nauseous. And a lot of times that's just due to the VOR being impaired, and our head and our eyes don't move together like they should. And it could be so very slightly off for an athlete and can very much impair them. So now somebody like all of us walking around the world, we could have a slightly impaired VOR and maybe not notice it as much, but elite athletes very much notice it. So I would use that information to help drive my treatment plan, how I put these exercises together, all piggyback off of how they do on the gaze stabilization test. My story back with Dr. Erickson at Arizona State University, one of the things he asked was for me to help him write a balance test, and one specific to athletes, and that could really help him understand, okay, he has a football player that he thinks has a concussion but also hurt their ankle, and he's like, they're off balance, and I don't know if it's the ankle injury or if it's truly the head injury. So he said to me, Shelly, please help me. I want it to be objective. That's his number one thing. He wanted it to be objective. And I want it to be where both feet are on the floor and that it is very sensitive to any athlete. Like, so the tests that were out there at that time were, stand on one foot, stand heel to toe, kind of more static in nature. So I, together we did, but came up with what's now called Cobalt. So Cobalt is the concussion balance test. It was initiated purely for athletes. Over the years, since we've published on it, we have found that it's a balance test that works for anyone. Basically, it's actively stimulating the visual and vestibular systems, which to me was the most important when it comes to athletes, because if you think about it, all the tests that are out there for balance, you're asking someone to stand still. And on this assessment, you're asking the athlete or the patient to move while they're trying to stand still. And that's how we move around the world, right? So none of us just stand here like this. So to me, it's very sensitive, and it is by far my go-to. So Cobalt is the balance test, gaze stabilization testing, and the battery of everything else that we do. But those are, to me, the key components to treating concussions. So this is Erica, and she is my patient that I'm treating right now. So Erica is, she plays soccer. So she's, club soccer, played soccer in high school. She came to see us and saw our physicians. She was concussed about a little over a month ago. So came to see us just a week ago. But her history is that she got a concussion. She went to her primary care doctor. The doctor just tried to treat it with rest, just take some time off. Her profession is that she's a professional dog sitter. So she's working with dogs all the time, which is like bending down, up and down. And then she loves soccer. So she took some time off, didn't do any active therapy, and just wasn't getting any better. And so Erica's primary complaints were, I'm dizzy and off balance, kind of nauseous, and that whole thing, what I was saying about, like, I just feel like I can't really see well when I move my head around. So that physician, her primary care physician, sent Erica to go see an audiologist, which is wonderful. So this was one of the cases where I was able to get the battery of tests from an audiologist that we work closely with. And so when I saw Erica, I already had all of the assessments that you would want as a therapist: gaze stabilization, the whole exam that an audiologist would do. The only things that were abnormal from the audiologist was gaze stabilization, and Erica was off balance and dizzy. So like I said earlier, I still did my own exam, and my exam coincided perfectly with what the audiologist said too. So her gaze stabilization test was below normal for her age and for what she does for her activity, and her balance was off. So I did my clinical exam, and then, like I was telling you, my objective information that I want the most is to test Cobalt. And I really will try to do Cobalt day one on the first time that I evaluate someone, whether they're concussed yesterday or they're concussed like Erica over a month ago. Gaze stabilization I don't do as often on day one, usually because it causes them to be pretty symptomatic. But I was able to do that with Erica on our initial evaluation. So she's back, and I'm going to now reassess Cobalt. So she didn't do well. The first time she did it, she couldn't finish it. So that's pretty common when we first assess Cobalt. So she's been doing some exercises, which we'll go over a little bit later. So I'm going to reassess her right now. Okay, so here's Cobalt. I'm going to go through the whole assessment. So Erica is on a force plate, so it's objective. It's measuring how much sway she has. I'm also going to count errors, and if she loses her balance, then I will explain what the errors are. But I'm just going to take you through the whole assessment. Every condition we do is done two trials. Okay, so this is basic. We're just going to see how still she can stand. Okay, keep your eyes open, look straight ahead. And what I'm doing now is I'm testing how still she is, so I hit start. It's 20 seconds for each trial, and each condition is tested twice. Perfect. And we'll do it again. Great. Okay, now Erica, I want you to close your eyes for me. Stand as still as you can with your eyes closed. Okay, I'm testing you now. Perfect. Open them up. Okay, you doing all right? Mm-hmm. Okay, one more time. Close them for me. And I'm testing you now. Perfect. Open your eyes. Okay, so this next condition is the one that Erica had a hard time on when I initially tested her. I'm hoping that she's going to feel better today. So Erica, you're going to put your hands back on your hips. And now what you're going to do is, you can hear that metronome. So I want you to turn your head side to side to the beat of the metronome. Perfect. Now close your eyes. And I'm testing you now. So what I'm doing as the therapist is I'm making sure that that light is going to each of the far lines on the poster. And what that's doing is ensuring that she's moving her head the appropriate distance, and then the metronome is keeping her at the appropriate head velocity. Okay, open your eyes. Way better. You feel okay?
Yeah.
Okay, so let's try it one more time. Go ahead and turn your head and close your eyes. Good, testing you now. Good, just a teeny bit more to the right, Erica. There you go. So using the poster, the metronome, and the light is what allows us to make this assessment reproducible. So if you didn't have all that, go ahead and open your eyes. Great. Are you okay?
Yeah.
If we didn't have all that, then she could be turning her head really far, really fast, maybe too slow, and you never would really know exactly where she is and how she's improving. So that's significantly better. She couldn't do that at all when we first assessed her. So now put your feet close together. So this is called visual motion sensitivity. So Erica, you're going to put your arms straight out in front of you, put your thumbs up. Good, and I want you to just put that light on your thumbs, yeah. And then you're going to rotate in blocks. You're going to go left and right to the beat of the metronome. So, good, and now keep staring at your thumbs. Perfect, and I'm testing you now. So what I'm doing is, A, making sure she's looking at her thumbs, and then also making sure she's rotating to the appropriate distance and staying on the metronome speed. Perfect. I'm also looking at her feet, and I'm looking at how she moves. Okay, so this is really visual motion sensitivity. So what she's doing is she's canceling out the VOR, and she's having to stare at her thumbs. And what that does is, if you look at your thumbs, it creates this kind of moving background, which is really what athletes have to deal with all the time in sports. So this is hard for athletes when they're concussed. So go ahead and one more time. Okay, stare at your thumbs. Good. I'm testing you now. Perfect, great job. Okay, go ahead and step down. So now we're going to do those same 4 conditions, but with Erica standing on foam. Okay, and what the foam's going to do is take away her ability to use her feet as well, and makes the assessment much more challenging. So go ahead and step up on there. Perfect. Good, your feet actually are really good. Okay. So same thing now, hands on your hips, your eyes are open, and just look straight ahead. Testing you now. Perfect. You're doing a lot better, Erica. I'm so excited. Okay, one more time. Here we go. Perfect. Okay. It's going to get a little harder. Now I'm going to have you close your eyes, okay? Mm-hmm. All right, so eyes closed. Here we go. Great job. Open them up. Okay, you ready to do it one more time?
Yep.
Okay, close them for me. Here we go. Perfect. Okay. All right, so here's the hard one, right? So you're going to do what you did before, eyes closed. Turn your head side to side to the beat of the metronome. Okay. Good. Close your eyes. Here we go. Testing you now. Good. Keep going. A little more to the right, Erica. Keep going. Good. A little more. Keep going. Good job.
Whew.
What's your dizziness? 0 to 6?
3.
A 3? Okay. So just stand here for a minute, see if you can. You all right?
Yep.
Okay, let's just do it one more time. Hands on your hips. You did great. A lot better than last time I assessed you. So, all right, turn your head side to side. Good. Close your eyes. Testing you now. Good. Keep going. A little further to the right. There you go. Good. Keep going. Good. Keep going. Awesome. Really good job.
That was better.
Yeah. Okay. We have one last condition.
Okay.
You're gonna be okay? Okay, feet close together. All right, arms are straight out in front of you. Okay, you got lights right on your thumbs. Okay, and then side to side to the beat. Good. Good. I'm testing you now. Good. Keep going a little faster. Good. Okay, get your feet back together. Keep going. Awesome. You want to grab the wall?
Yeah.
Are you okay? Okay, just deep breath in. We got one more and we're all done. You couldn't even do this last time, so think about that, right? You're doing it. Okay, straight out. Okay. Ready? Rotate and block, so right. I'm testing you now. Go a little faster. Good. Try to keep it nice and smooth. Keep going a little faster. Awesome job. Okay, so a few things to talk about with Erica and how she did on Cobalt. So whenever a clinician or a therapist is doing Cobalt, the things that you're looking at are really her balance strategies, okay? Because that's going to help me to figure out what I'm going to do for treatment for balance. I'm also counting errors, okay? So there's just 4 errors that can occur in this test. So it's if you open your eyes during an eyes closed trial, if you take your hand off your hip at all because you're off balance, or if you move your foot and take a step because you're off balance. And then one of the hardest ones is if you can't keep up with the metronome, right? And so I think that was a really good example because Erica was having a hard time keeping up with the metronome, but you would have to not be able to keep up for 2 beats or more. And my job is to cue her. So I kept cueing her and she was never off more than just 1 beat. So on condition 7, that's the eyes closed head shake, she was very unsteady, but she never lost her balance, okay? So she didn't do any of those things. She didn't open her eyes, she didn't take her hand off her hip, she didn't step. She was having a hard time keeping up or maybe not going so far, but she corrected every time. But it was interesting to note that she was really not smooth with her head movement, okay? So think of all of these things when you're gonna do treatment. On condition 8, the one where you stand with your feet together, arms out like this, so she was more steady, in my opinion, but she lost her balance once, okay, on one of the trials. So when we're through with the test, the computer will give me what her sway scores are, and then I can compare her to her peers at her age. So Erica's 31, so the norms go up to 25 right now, so I have to compare her to a 25-year-old, but she's a really athletic person, so I don't have a problem comparing her to a 25-year-old. So on condition 7, her sway scores were in the 30th percentile. So that means that 70% of the people that age would do better than her, and I don't think that's Erica at all, and she's not going to go back to soccer when she's got that kind of balance. Condition 8, she was more steady, right? So her sway scores were in the 75th percentile, but she lost her balance once. So what would I do for treatment with this? First of all, I write goals on this all the time. So number one would be, when I wrote her initial evaluation, was that she could do cobalt, because she couldn't do cobalt when I tested her first. So she's achieved that goal. So then my next goal would be that she could do cobalt without any errors, okay? So she's not there yet. And then the third goal I would write would be that she can do cobalt without any errors, and her sway scores for condition 7 and 8. For Erica, I'd put her, above the 60 to 70th percentile. And that's just me as a clinician. I know her. I feel like I've gotten to know her really well. She's been an athlete her whole life, and I feel like she should have that kind of balance to get back to soccer. So we have some things to work on. And primarily, if you notice, she was perfect on a firm surface. When things started really breaking down for her was when she got on the foam and had to move her head, right? And challenge her visual motion sensitivity. So those are things that I'm going to say that I'm going to focus my treatment on. So I think that is the most challenging question you could ask for concussion is, really where do you start and how much is too much? So the one thing that I've learned over the many years of treating concussion is that it is a diagnosis that you definitely don't want to push through your symptoms, okay? So I want Erica it's okay for her to get dizzy, it's okay for her to be off balance, but I want those symptoms to go away pretty quick, okay? So I follow what I call the 3 to 5 minute rule. So I already told Erica this because on her first visit, I'm going to show you some of the exercises she's been doing at home. But whatever we do, what I do is I'll ask Erica, okay, so right now, what's your dizziness on a scale of 0 to 6?
0 right now.
Perfect, okay. Are you nauseous?
No.
Okay, do you feel off balance?
Little bit.
Okay, 0 to 6.
2.
A 2? Okay. So I'm going to remember those, right? Do you have a headache?
No.
Good. Okay. And so then as we do the exercises, as I'm noticing that they're likely going to provoke her symptoms, that's great, because then that means I can help her and she's going to get better. But if her symptoms go up to a 6 and they stay at a 6 for 15 minutes, then whatever I did was just too much, right? But if it goes up to a 6 and then we stop and maybe she sits down or she leans up against the wall and it comes right back down to either a 0 or a 2 or where she was, then we're great and we need to do it more. And that's how I start to develop my exercise program. Now, I develop it off of the results I got from testing. So we've been talking today mainly about cobalt and gaze stabilization. So for cobalt, it's a balance test, right? So I'm going to look at how am I going to challenge her balance. So we saw it today. Erica had a hard time on the foam, right? With her eyes closed, head shake, and the visual motion sensitivity. Well, when I tested her the first time, she couldn't do cobalt. Okay, so she couldn't get past condition 3, which was eyes closed, head shake on a firm surface. So her home program, which you've done great with, and this is why Erica was able to do cobalt today, because she did these home exercises 3 times a day is what I told her. But so they're pretty basic. So I started with her feet apart, but just make it more interesting. So feet close together. Okay, and then show me what you're doing with yep. Good. And then up and down. So these are what we call habituation exercises, which is just really stimulating to the vestibular system. Good. Now eyes closed, side to side. Good. And see how steady she is? So this is significant from what she was the last time that I saw her, and up and down. Okay, so these are just way too easy, right? Couple things really quick. So I need to make it harder, and we already know that she can do this on firm surface, so then the next thing I'm going to do is put her on foam, and we're going to start to challenge her balance. And honestly, it's the same things that I did with cobalt. So I want her to be able to stand and stay steady with her eyes closed on an uneven surface. And then once she can do that with her feet apart, I would do feet together, maybe stand with one foot out in front, and then we're going to start making it a lot more dynamic. So we're just going to do it walking, doing, kicking a soccer ball. So everything where I'm thinking about having her move her head and really stimulate the vestibular system. So those would be more what we call habituation exercises. When she's doing things with her eyes open, I'm not having her look straight ahead and do this. Okay, that's more like gaze stabilization exercises, which we'll go over, but having her look right and left. So her eyes are going with her head, and that's a different feeling than, honestly makes you a little bit more symptomatic at times. Now everybody's different. So you got to watch what they're doing with their eyes, and it looks so basic, but you just take a basic exercise and then you progress through various levels of challenge, right? So you can start adding cognitive tasks, you start dual tasking. Everything is start with the basics and then keep building on it, right? So okay, Erica, let's try the foam. And I'll give my athletes the foam to take home. So Erica will take this home with her today. Good. Okay, so now we'll start with eyes open.
Okay.
And side to side. Really good. So she's really, and her feet are together. On Cobalt, your feet are apart, so this is harder, and she's actually doing really well. Up and down. Good, and then eyes closed. Good, side to side. So you can see that with eyes closed. Definitely harder for her. Okay, so let's stop. What are your symptoms? Dizziness.
Yeah, it's probably at a 4 now.
Okay. Do you have a headache?
No headache still.
Okay, balance.
Pretty steady at the same, like a 2.
Okay, so step down, and so what I would do there, and I mean, she looks fine, right? So she actually looks pretty good. So I would just have, just maybe lean up against the wall, take some deep breaths, and then you just want to make sure that her symptoms don't stay up at a 4 for the next, 10 minutes, because then really then we're challenging her too much. But I can already tell she's going to be okay.
Yeah, they're both getting better now.
Good, good. So to progress that, first of all, I'm going to give her that for home. And I'm going to say feet together, but then when you're at home, and we do this in the corner so she doesn't fall. Eventually, I'm not having Erica in the corner. She's an athlete. She can be out in the middle of the room. She has great balance strategies. But we start in a corner just for safety. And it allows her to just kind of grab on if she needs to, if she's getting too dizzy. But she'll take the foam with her. I'm going to have her do feet together, 1 foot out in front, maybe heel to toe. She can maybe stand on 1 foot. She's just going to keep challenging her balance, and then continue with her walking with head turn exercises at home, and then start doing it outside. Because we got to get you back to soccer. So that's her end goal. Get back to soccer, make sure that she can play again. So we're getting there. Okay, so those were habituation exercises, or that's what we call them. Now, let's go over your gaze stabilization exercises. So these were the exercises, Erica, that we used the card, right? So I modeled these. So I do the gaze stabilization test, right? And then I look at how fast can they turn their head to the left and the right, and where does that breakdown occur? So when can she no longer clearly see the letter moving her head at certain velocities? So Erica was around 130 going to the left and the right, which is below normal for her. So we've done studies, and for athletes and elite athletes, they really should be at a head velocity of around 180 to 200 degrees per second if you want to play sports like you're playing. So I need to get it to where I need to have Erica improve her ability to clearly see just moving her head faster. Okay, so with the gaze stabilization exercises, I started with the playing card. Now I want you to do this card with more letters. Okay, so look at that letter A. I'm going to set the metronome. We had you at I remember it was around 130. Okay, good, perfect. Are you still at 130 at home, Erica?
Closer to 120.
Okay. I'm going to push you. How's this making you feel?
I'm doing fine.
Okay. Now keep going, and I want you to change your feet and stand heel to toe. Good, now up and down. Perfect. Okay, and stop. So I would have her do that 3 times a day, 5 times a day, whatever she can do. The more she does, the better. She's really retraining the way her head and her eyes move together. And Erica, you seem okay.
Yeah.
See, that's not as bad for you, yeah. So I do the same thing. Have her on foam, then we're going to start doing the same exercises, moving around. I'm going to have her walk and do exercises, and then I'm going to add in cognitive tasks too. So I'm lucky because I have a lot of equipment that I can use here, but really the end goal is that you can do a lot of this therapy without any equipment, but it's nice to have extra things to really add in and make you and challenge you a little bit more. So we're going to do one more exercise today, and then we'll have you go home, and then we'll add some more in next time. Okay, so Now we've gone through the exercises you're doing at home, and those are, they're challenging, but somewhat basic. Now we need to add a little bit of a level that's harder to keep your balance, and also a cognitive task. Okay, so I'm just going to use this ball as a light up ball. So when I bounce the ball, it's either going to it's going to light up red, green, or blue. Okay, so if it's red, you catch it with your right hand. Okay, if it's blue, you catch it with your left hand, and if it's green, you're going to catch it with both hands. Okay, so let's just start with that. Okay, good job. Okay, now Erica, while we're doing this, I want you to count backwards from 30 by threes, okay? So go ahead, start at 30.
30. 27. 24. 21. 17.
Yep. No.
14.
Okay, so yeah. So it's 18. Yeah, it's hard, right? It's hard. Okay, so that's just adding another. Is this making you dizzy?
No, I'm okay.
What about headache?
Headache is still there, but I did feel a little off balance when I went to the laterals.
Okay, so now I'm going to make it harder for you. Are you doing okay?
Yeah.
So now what I'm going to have you do is I'm going to put it more to the sides, okay? And then I also may have you turn in a circle when you do it, okay? Okay, so Erica, now let's make it a little bit harder, all right? So I want you to really try to move side to side. So think about some of the things you have to do when you're playing soccer. Same thing though with the, catching it red, right, blue is left, green is both, okay? You ready? Nice job, really good. Awesome, one more. Perfect. Okay, so now we're going to make it even harder. I want you to turn around. Okay, and I'll tell you when. I'm going to say turn, and I'm going to say either left or right. Okay, so that means you have to turn left or you turn right, and then you're going to do the same thing. Okay? All right, left. Nice job. Okay, turn around. Left. Great reactions. Right. Left. Perfect. Right. Oh, my bad. Right. Perfect. Okay. You all right? Mm-hmm. Good. Yeah. All right. So these would be things that I would think that you would want to, I think you're ready now. Like kind of start dribbling around the ball, right? So you just do stuff outside, keep doing all the exercises. We really we got to get you to where I think you're really close to starting doing the return to play, and you've been working out a little bit, so just keep doing that, thinking about moving your head as much as you can. Okay, and I'll see you next week.
Okay.
Okay, so Erica's back today and feel a lot better, right? Yeah, it's awesome. So I now want to start doing more sports-specific activities with her. Dual tasking, right? So I'm gonna add in the cognitive level, because that was pretty hard for you last week when we did that. I think you seem like you feel a lot better though. So we'll start basic, and then I'm gonna add in some balance tasks. Okay, so you're gonna stand in front of the board, and what'll happen is that numbers are gonna come up in these 9 circles. Okay, it's gonna start with 99. So you're gonna find 99, and then you're gonna just count down from 99 by threes, your favorite thing, right? So all you're gonna do is just hit the numbers, okay? And we're gonna just start that way, and then I'm gonna start adding some balance things for you to do with it, okay? So I just want you to get used to it, so come on over here.
So I touch the board?
Yeah.
Okay.
So we're gonna start the game, right? Hit go, hard. Yeah, there you go. Good. Okay, so you're getting it? Okay, you're at 90, just because I want to make it harder for you.
Okay.
Stand on here. Feet together. Okay, and you were at 90. Now what? Good. Okay, there you go. Okay, stand heel to toe. Gosh, your balance is much better. Great. Awesome. Okay, stop for a minute.
Okay.
How do you feel?
Good.
Really good. Okay.
Yeah.
So now step down off of there,
Okay.
and now we're going to do some things with the soccer ball. Okay.
Okay.
So you can stand in front of the board, but face me, please.
Okay.
Okay. Do you remember what number you're on? Okay. Turn around and make a guess.
63.
Okay. You want to hit it and see? Good. Okay. So now you know what you're at, right?
Yep.
Okay. So what we're going to do is we're going to kick the ball. I'm going to kick it to you. You kick it back to me. Turn around and hit the number you're at. And then same thing. We're just going to keep going back and forth. Okay. All right.
Oh gosh. 60.
All right. You need a break?
Yeah.
Okay. Take a break. Dizzy at all?
Not dizzy. Just the brain part.
Yeah. Okay. Yeah. Okay. Let's take a small break and then we'll continue on. All right, Erica, let's get going. High knees. Yeah. Full turn. Perfect. Yeah, okay, and go, yeah. God, you're seriously an athlete. Okay, now come up to the thing, do a full turn, and then go sideways, and then go around the ball. Okay, so full 360. 360, there you go. Okay, and then 360 the other direction, turning to your right. Nice. All right, Erica, awesome job. So you're ready to be discharged.
Yeah,
Get back,
feel good.
you feel really good. You're going to go back to playing, but here's what I think you should do. Okay. Come back here to our high performance center and let's do a full motion capture movement analysis on you, and let's really make sure that we bring you to the highest level of your game.